My name is Ummi Yusuf. I live at Jeka-da-fari. My marriage is blessed with 11 children, 6 males and 5 females. Ummi lives in Gombe State, which is home to about 3.5 million people. The majority of people live in rural areas like Jeka-da-fari, where Ummi lives with her husband and children. In the past, Ummi and her family depended solely on her husband for the family upkeep. Although she styled hair for women in her neighborhood, her earnings didn't add much to the family income. So when her husband suddenly fell ill, became bedridden and out of work, the family struggled to make ends meet. The situation deteriorated for months until Ummi joined a group, Pact's Worth Mothers Group. Worth Mothers Group are comprised of 25 to 30 women each, in which the women come together to lift themselves and each other out of poverty. Pact, an international organization working to improve the lives of people, established 1,872 Worth Mothers Group across 114 wards in Gombe State, reaching and benefiting over 46,800 women. The groups aim to help members save money, access loans for business and healthcare, and gain literacy skills and life-saving health information. Pact partnered with the Gombe State government and 3 community-based organizations to form the Mothers Groups under the State Accountability and Quality Improvement Project, SAQIP. Funded by the Bill and Melinda Gates Foundation, SAQIP worked to improve maternal, newborn, and child health in Gombe State, where mortality rates were among the highest in Nigeria. In Jeka-da-fari, the district head, together with the staff of community-based organization, Doma Education Development Foundation and SAQIP, invited Ummi to join and help mobilize other women into the Mothers Group. She agreed and helped set up the Jeka-da-fari Mothers Group. Ummi participated in all the group's activities, including literacy classes, health education sessions, and a weekly contribution of 100 naira, less than $1. Before we started the group, I wasn't doing much. I started off with hair plaiting business. I reserved the income I generated for festivities, such as weddings and naming ceremonies. Whenever I fell ill, I would not use this money, but rather I would wait until my husband gave me money to visit the hospital. But when I joined the Mothers Group, it all began like a joke. But before I knew it, we ended up saving 100 naira weekly. We couldn't believe it. Whatever amount is generated after a certain period will be loaned to a member to start up a business. The member pays it back after a period. We use piggy bank as our safe. Before the SAQIP intervention, we couldn't read or write our names, but now we know how to. We can write our names and even read letters, written in Hausa. This allows us to trade in the market. Within a short period, the Jeka-da-fari group raised enough money to loan out to members. Ummi received an initial 10,000 naira loan, about $30, which she used to start a small food business of making and selling local delicacies from home. Ummi repaid her loan with profits made from her business. She then took more loans to grow the business, including hiring 7 people to work for her. As the business grew, she had enough to meet her family's needs, including paying for her children's school fees, husband's medical bills, and drugs. All her children are back in school, and her husband is recovering well. Regarding visits to hospital by women, we encourage them of the importance of hospital visits for MNCH services. There are recorded cases of women bleeding during delivery at home. Some women believe in traditional herbs instead of going to the hospital. But with the health education sessions we receive, we know that this bleeding can be minimized at the hospital. With SAQIP intervention, we understood that when one is sick, we don't have to wait for our husband. Following the health sessions she received, Ummi has been talking about the importance of proper health care to women outside of the group, including mothers-in-law about allowing their daughters-in-law to attend antenatal care and deliver in a health facility. She is now a maternal and child health advocate for Jeka-da-fari and neighboring communities. Overall, Ummi feels proud of her new status that enables her to contribute to her family's financial needs and adds value to her community. Like several thousands of women who have benefited from the Worth Mothers Group, Ummi praises the model as what women like her need. Pact is committed to partnering with local organizations, the private sector, international donors, and the government to replicate and use its award-winning Worth model to empower more women, families, and communities in Nigeria and across West Africa.